rolling. Here's really an old favorite for working with the back, and the beauty of it is that it's incredibly easy on the therapist, which we like always to make our work as easy as possible, and we can bring quite a lot of weight and force and useful energy to bear without working too terribly hard at all. And I've situated here, at the start I'll show you how I can work this with me on the table and my model sitting just in front there, and this is so I can be sure that I'm getting up and over the work that I'm doing. And one of the things you want to make sure of here is that you're not disadvantaging yourself by kind of getting at this angle with your fists. You really want this kind of angle where you're able to really bring yourself up and over the contact that you make. And I'm tall and I probably could work with my model from the ground, but I'll show you this way because this is a fairly common approach that we need to take with this position. So this is how it looks. We're going to work through a series of releases, and they're all connected by virtue of the fact that they're to do with the back, but starting with the trapezius, levator scapula, and as we know the upper fibers of trapezius, levator scapula, they can both become incredibly tight. To speak in the vernacular, they're tonic muscles, so they've got this slow twitch sort of function, and one of the things that happens with those muscles is that they quite often become fibrosed and short and stiff and increasingly problematic. So this is how it looks, just starting with a broad contact that's made with a soft fist. And so we've looked at this in different DVDs, but in case you haven't viewed anything else up to this point, by a soft fist I'm just referring to something that's a little bit like this, rather than a more sort of closed, stiff fist that we might use, say, in martial arts or something like this. Here we've got quite a soft fist. So this is how the first contact looks. I'm going to go up 1 foot, 1 knee, and I'm over the top now of, really feel like I can get the weight up and over the trap, levator area. And if it turns out that I don't feel that I'm high enough, why, of course, there's nothing to say, and I might disappear from view here for a moment from the camera, but there's nothing to say that you can't stand up to do this. So we can even be up on the table and working in this manner. And if that's what it takes to feel like you're able to bring some good strength and stability, because we need both of those things as we're working, we'll use this. So I'm landing and sinking. So that basic protocol that is employed in this work, landing and sinking, and I can feel my model starting to make a very sort of nice response just to the sustained weight and the sinking, and now I'm starting to put some tension going from medial to lateral. So I'm spreading out basically towards the AC joints. Keep in mind that you will be riding across the first rib as you go, and don't want to mistake that first rib for a particularly gristly pit of the trapezius. It's a bone, we're not going to rub it out of existence, and so we just want to ride up and over it and then head on out towards the AC joints. A few interesting sound effects in the background there. So you can see I've just picked it up and I've gone back to the middle and I'm starting again. So I'm just taking that fairly slow, steady contact across medial to lateral, and it's done bilaterally at this point. I'm going to come back down onto my knee. I don't really need to be up there. And this is how we proceed. Now generally, and I'd say a high percentage of times, as high as 80 or 90%, this feels basically fantastic. And it's something that you can repeat multiple times and often discover that the release increases the more you do it, and the person's usually appreciative of release in this area because it's such a chronic jam up for so many people. So this is what we're doing: landing, sinking, not forcing that, not over-pressuring it in a way that the person would retreat from us, engaging and then going to the side. We're certainly not trying to push their shoulders down to the ground, so it's not like a sort of pushing attempt to stretch the muscles, but it's all about melting and easing the tensions within the fascia, which takes some time and is not accomplished just by putting weight on the shoulders and trying to push the person down. I'm going to develop this a little bit further, and this time starts out the same, the soft fist, close to the midline, so the area of the thoraco-cervical junction. And this time I'm pulling or guiding my fists more towards the root of the spine of the scapula. And that takes me more directly in line then with the levator scapula, one of the more villainous muscles in the body, really, when you think about it. And recently I had a chance to be in the cadaver lab again, and one of the things we were looking at there was levator scapula, and sort of helped me appreciate really how much of a structure it is. There's just a lot to it. It's almost like multiple muscles, and yeah, so it's a significant structure, and we know that it gets pretty cranked up a lot of the time. So I'll just show that again. It looks a bit like the first one, it's just that now I'm changing the direction and bringing the contact from medial to lateral again, but also not so much spreading this time, kind of keeping it closer to the midline as I bring it back along towards the root of the spine of the scapula. I've talked about the technique, and that's probably the most important thing, but close to having equal importance is the position of your client. And one of the things that we're seeing here is a very nice organization of the stability in Merrin's structure while I'm working up here. And there's a few ways that we can make sure that happens. One is you'll see that Merrin's hips are higher than her knees, so her legs are dropping really, in a sense, in gravity towards the ground. Her feet are slightly out in front of her knees, but not a great deal. And even though I haven't mentioned to her the ways in which she might do this, what she's already done is make a contact through the whole of each foot. So not going over to the outer arch, not pushing only through the medial arch, but making a very nice contact that goes right through the feet. And this is a lovely kind of way to wake the feet up while we're working, exploring what's sometimes called opening the eye of the foot to the ground. And that connection to the feet can then support the work that I'm doing up here. There's a few other elements to the position that are worth noting. One is that if the hips are higher than the knees, then the hip flexors can let go a great deal, because what we want is to get a sensation of opening in the front of the hip joints in this position. So there's not a lot of pulling in the tensor and the rec fem. And what else is very nice here is Maren has a very clear sense of up through her head and her neck. And this is going to help differentiate structurally and neurologically the head, the neck, and the shoulders. And so what happens very often is that the shoulders sort of start to live off the base of the occiput there. They're kind of drawn up into the base of the occiput, and that starts to create a lot of strain in these upper cervical vertebrae, pulling on the base of the occiput. Okay, so we'll go on a little bit further. We can now start to add some motion, some fairly simple things. I'll just get back on that same kind of release that I was doing, which is bringing the myofascia or the levator from the midline slightly out towards the scap, and I'll ask Maren this time to just lower her head forward, so she's going to let her chin go in, and even then she can explore a sense of going that motion. She can still feel like she's going long up through the top of her head, so there's not so much a sense of collapsing but kind of rolling out on a nice big arc. Requires usually then a little bit more active engagement through the feet, which I can feel. So if I give her a bit of a push here, one of the places that she can support that from is all the way through in her legs. Yeah, I'm going to hold this tissue here and just have my model look to the right, so keeping her head down, I'm going to hang on more to the left side, and probably with that close-up view you'll be able to see the way in which I'm really hanging on to this tissue here, giving her something to work through very deliberately. And once again, this can feel fantastic where the upper trap levator complexes become chronically stiff and tight. And then I have to kind of reload here because I've been in motion slightly, so I'll just get back up a few centimeters, and then once again I'm going to hang on, this time through my right hand. Left hand still in contact, but not anywhere near as much as the right hand. In some ways it's like I'm putting the brakes on the right hand. Very nice. So that could also be repeated a number of times, and I'll just go back through it one more time, and I'll just this time have my model make a motion. She'll sort of explore the same motion, but then start to add some kind of more spontaneous sorts of twisting motions that might really help her isolate the way in which she can open it out. So she might just start off turning to the right, then she might discover as she's going, as our clients can, that there are certain ways that they can alter. There we go. So she's putting a little bit of a side bend and a rotation, and that is helping her explore sort of how to get at the tension that might be in there a little bit. So there's a little bit more chin down this time. Yeah, a little bit more side bend. Yeah, lovely. Yeah, so it becomes slightly less kind of prescribed, but sort of an exploration of how could I move my neck in such a way that would kind of help me untwist out of the tension. And you can spend 5, 6, 7 minutes doing work of this kind where the client just spontaneously sort of looks for pathways of motion that will really help them get this all to let go. And this can just feel fantastic. And there you can see, again, a lot of side bend, a little bit of twisting. Yeah, so all those nice composite movements start to have more effect than just working through one plane. Very nice. And come back to the center and have a rest. We've been working for a while. Going to extend that work. So I've been working fairly close to the thoracocervical junction. Going to take this now down into the thoracic spine, and in the end down into the lumbar spine. Going to have my model actively working to assist with this process, and the motion in general is that she'll be rolling forward but at the same time pushing back from her feet into the contact, and they're not mutually exclusive motions. Sometimes when it's described it's like how would you roll forward and push back at the same time, but you'll see how that goes. And this is very nice, again, because it connects all the way from the ground through the body up into here, and this is how it looks. I'll have you just start this time to roll, and again still that sense of length going through as you go down. And I'll just pick you up here, so just kind of put the brakes on there for a second. So this is bilateral, and it can be broad through all the knuckles, and that's just basically catching as much of the myofascia between the scapula as I can. And I can just have you roll forward a little bit further from here, if that's okay. Just kind of let it out a little bit further, and at the same time sort of push back from your feet. Yes, very nice. Yep, so she's done the good thing there and just let her arms go floppy. So we're looking really for the shoulders to just kind of ride with the rib cage at this point, not so much try to brace or lead the motion. Good. There's a couple of other things we might ask for that will help with the opening here. One is just to find the back breath, so that these back ribs move. Well, they're the same ribs, of course, as the front ribs. It's just that quite often the focus in breathing is all to the front, and so the back and the sides of the ribs don't get much attention. Good, good. Yeah. Okay, good. And come back up. So have a rest. This is a fair ask. So you're going to have to read how much can they work with this, how many minutes or seconds can they stay in that engaged position. So if you've got somebody who's done lots of Pilates and dance and has a high degree of coordination and knows how to stabilize and do all those things, you can probably work here for quite a long time. If you're starting with a client who has none of those things in their background, a lot of what you're doing is just educating them about the position, doing the motion for a little bit, working, and having them come back. Yeah. But here, Mary knows how to turn on the stabilizing muscles, turning on the transversus abdominis, so just getting that sort of stability happening through the trunk, and then letting it go into motion, supporting it from the feet. And so we can go through it again. We'll just pick it up where we left off last time. So she rolls down, yep, and just about there. So you can see that I'm not really pushing her that way, and this is important. The actual vector, even though there is a component going that way, I'm basically moving down her spine. So I'm moving from superior to inferior. or caudally, if you like that sort of terminology, towards the tail. Yeah, so I'm not just forwards. In fact, I'm trying to get her to make a giant kind of arcing motion, almost like she's going over a big beach ball. Yeah, and yeah, if I feel like I lose them, which you will at times, then I'll just say, can you reconnect with the kind of leaning back or squeezing back, swelling back into, that's lovely, good. And keep rolling forward. And I think you could just about build a practice around this technique. Done well, just kind of addresses so many issues in the body. I can see probably with the close-up camera, just taking my fingers in behind the bra strap, moving down, then I can just move it up and sort of pick up where I left off. So that's easy enough to work around. Yep. Yeah, and just come back into this a little more. Beautiful. Yeah. Good. And keep rolling. You can just let that on go a bit further. That's good. And even here, finding also that you can roll and push back in. Very nice, very nice. I think we're going apart from each other. The chair's off in motion. No, it's the table, even though the brakes are on. But I think we'll be okay. We'll see where we go here. Good. You all right there? Mm-hmm. Yeah, good. And, okay, we need to stop there. Okay, so yep, just have you roll forward again. Yep, just that nice kind of articulating each vertebra, which is certainly something we've seen my model here today working with right from the beginning, that sense of isolating or articulating fairly independently. Yeah, and so I'll just pick this up where I was. And now you'll see how I can come around now off the table. I certainly have no need to be up that high. So I've come around now from the table, still using the table with that knee, of course. But yeah, once again, I feel that I can get the best sort of advantage to my work by getting in a little bit closer. And this is lovely, good, and you can just keep going. Yeah. Yeah, so once again, I want to restate that I'm certainly not trying to load her back up in such a way that she feels like she's trying to hold my weight with her erector muscles. So you can see the kind of tangent I'm making to her curve means that what I'm doing here is lengthening the tissue, putting some load on the vertebra, but not that much. Now I've come to the PSIS. I can feel the bony prominences. Going to come across those. Keep working down. So just following that fascial continuity that we know exists right from the neck. The thoracolumbar fascia goes as high as the cervical spine, it turns out, and we can really follow it down across the sacrum as well. So we have that whole posterior lamina of thoracolumbar fascia, which could be called the cervico sacral fascia in many ways. So, in coming up, I'll just ask for my model to kind of reverse the process, that she's just going to let all this come up one vertebra at a time. It's like kind of rolling it and stacking it from the bottom up, and the last thing will be the head to come on. So the shoulders will kind of be second last, neck and head. That's very good. Okay. Most of that work has been done fairly close to the midline, so really parallel to the spine and broadly. So I did that through a number of knuckles. And it's also possible and often very desirable, and once again it feels good. I won't go through the whole thing, but I'll just show how just by switching the focus much more into the first knuckle, we can really get much more into the laminar groove. So we're then starting to sink a bit more specifically into some of those smaller muscles that lie next to the vertebra or over the top of the vertebra. And that's how that might look. So rather than just trying to catch everything, I could take that first MP joint and really clean the gunk out of the laminar groove, just to use a very technical term, that sort of fibrous gunk that piles up in there. So that's how that would work. So it's just really reorienting a little bit into a much more sort of pointed, without wanting to sound too harsh, because it's not, but yeah, a bit more specific, and that can also feel very good. The next thing is even broader than what we've been doing, and it starts out on the spine of the scapulae. So I'm working bilaterally, as you can see. I've got both hands working at the same time. This time I'm just bringing the tissue from lateral to medial and inferior, and the inferior part is important partly for us as the therapist, because if we don't bring it inferior, we start to feel a bit like we're doing the pec deck at the gym, and most of the time our pec doesn't need any kind of additional workout at all. It is probably been overactive. So if we put this inferior component in there, keep feeling that our scapula in ourselves sort of stay wide and down our back, then we can sort of shift the focus of where the strength comes from there, from the pecs, and share it amongst some other more useful structures in our own body. So you can see on the close-up how that starts to come in towards the spine, and I'm really at that point wanting to think about the ribs affecting the fascia that lies over the top of the posterior angle of the ribs. Yep, and I can just again ask my model to roll forward. I'm going to drop it down slightly, a few centimeters, and repeat. And once again, their job is to explore the ways in which they can breathe into the back ribs and also make the contact with their feet. And I have you roll one more time. Down, So here I've come in behind, standing, coming off the table, and you can see I'm able to really get good support here through my feet and my own stability, kind of working with that as I'm doing this. So yeah, not forgetting about my own up in my own head, my own scapula resting with the ribs, not trying to find their way up into my ears. And this is all very nice for awakening the back of the breathing, which is absent in so many people. And one more, we'll do one more, just roll over a bit further. Yep. Very nice. Okay. So that completes a round of work that's really designed to get the broad myofascia of the back released. And so released, that would mean softened, lengthened, more pliant, all these kinds of words. We don't want to try to make it all sound too scientific. What we're doing, the felt sense internally is of there's space, there's ease, there's a certain kind of mobility, pleasant sensations of space and openness, and this is a lot of what we're looking for. And so yes, we can describe it in terms of tonic muscles releasing and things like that, and the other part of it is the value of the sensation for the client. It feels good to get these sort of big, tight muscles that are sort of basically working way too hard in many people, and kind of overriding the more subtle functions of the body. It feels fantastic to really turn them down and hopefully sometimes even turn them off in a sense. Okay, so that's the general broad work for the back. I'm going to show a couple of things that sort of just are, you could say, variations on that theme, and it's just to work unilaterally this time. So I'm going to work off one side at a time, and the way that would look would be I can use an elbow in there. So it doesn't always have to be done bilaterally. If I feel that I've got a pretty specific restriction around here and I want to get a bit more pointed with it and a bit more precise with addressing it, then I can work in on that with my elbow. And once again, the advantage to the therapist is probably fairly obvious, that you can see I'm standing fairly comfortably in my own body, my own structure doesn't feel compromised in any way to deliver that, and then I can lean in with a certain amount of, I can grade the pressure, I can be fairly subtle with that, or I can work in and really work fairly sort of incisively would probably be the right word, with some of those deep-seated, long-standing restrictions around the base of the neck there. And now you can see that my model's taking the pressure and utilizing it with some sort of self-mobilizing. So she's dropped her head forward, and you can see that all I have to do in a sense here is kind of hang on, put a bit of a drag, and then she could explore the various kind of twists and turns and kind of counter pressures that will maximize the release. Just like so. Okay, so there's a variation on the theme there. Okay, very nice. What we've seen, seated back work, and it's a bread and butter approach to working with the back in my practice. Love it, and clients love it as well, and it can unload a headache in progress sometimes in just a few minutes. Client comes in, headache in progress, and we're able to sit them there on the stool and work around their traps and so on before we get into the perhaps more detailed work in the suboccipital triangle, or feeling into some of the deeper levels of the cervical muscles or the upper thoracic. I could hardly sort of overstate the potency of that work. But I also like prone back work, and that's what we'll be looking at next. The work will begin up around, again, the thoracocervical junction, and I'll start with a bilateral approach, and so that'll be with two soft fists. And this, also it's one of those things that about 90% of your clients will love the sensation of once you start to take the tension out of that area of their back. And then we'll develop that bilaterally, and then I'll show some ways to become, once again, kind of working from broad to specific. So this is how the first contact looks. So there's the landing and sinking. And I think one of the nice things about some of the close-up shots is you get to see how kind of literal the sinking is. Even though it's not over pressure, you can see that there's quite a bit of kind of giving way, not just sort of in the skin, but right through even into the vertebra and the ribs themselves. And then I'm just taking up the tension. And here we just have your kind of classic ironing out the back effectively. With my long arms, I'm able to stay at the head of the table and take this work all the way down to the sacrum. And in other instances, you'll find you'll want to come around somewhat to the side of the table to accomplish that. And if it starts to feel like there's too much of a twist going on in your body as you try to do that, basically don't do it. If it starts to feel like it's causing you some sort of distress in your own structure, don't do it. And again, that goes to the level of the PSISs. And a little bit beyond. So that can just be a really wonderful opening move for work that you're going to do in the back, where you might go more deeply, more specifically. It's tremendously relaxing. Probably a good amount of that is occurring through the autonomic nervous system. That sort of slow, sustained, steady, firm pressure through the fascia activates all these nice parasympathetic responses. And that's a nice sort of foundation then to start in with some more work, just starting to address some of the overexcitement quite often in the sympathetic nervous system. So that's the broad bilateral approach, and we can then start to bring the work a bit more into the laminar groove. And this time I'll be working with my elbow. I'll be working close to the olecranon process. Rarely do I work right on the process itself, but I am close to it, so in this zone through here, and you'll see how that looks. One of the joys or advantages of that approach is that it takes us now down more into the deeper layers. And so we've got 4, or some people say 5 layers of back muscles, and so right down at the level of the multifidus and perhaps the rotatories as the 5th layer. But anyway, we know we've got these deeper intrinsic muscles that just go from one vertebra to another, or one vertebra to 2 other vertebrae. And this more specific pointed work with the elbow enables us to make a more direct response to that. There are ways to work with even more specificity, and one of the things that you could do just to help you ascertain where that stiffness might be would be just to give very simple kind of motion tests through the spine. So that would just be taking your thumbs on either side of the spinous processes and just giving slight pumping motion, and what you'll discover is that the response to that pumping motion is not even throughout the spine, that there are going to be some areas where you'll notice, that's definitely stiffer. Here we've got a nice sort of trampoline feeling, nice pushing in, nice rebound. Push, rebound, push, rebound, push, rebound. So there was a spot more up here where I can do my bouncing test. There's a sticky spot. Not terrible, it's not immobile. Yeah, and if I feel it, that spinous process feels like it's pushing back a little bit more firmly than the others. If I push on the one below it, it has a bit more motion. If I push on the one above it, it has more push there. Not so much. So that would be another possibility for this elbow work done unilaterally, would be to just hone in on those areas of local restriction. Again, it's always wanting to make sure we're not doing overpressure, but just giving really nice, firm pressure so the body pays lots of attention to what's happening, and then you'll feel nice giving way. And that's to do with probably not only just those 4th and 5th layer muscles, but also even the ligaments around the joints. So there's two ways to work with that. One is just to generally work up a way along, cleaning out the laminar groove, and the other one then is to find these areas of local restriction. And that, of course, the whole thing can be carried on down the back. And we want to just be careful as we're working here to not work along the spinous processes themselves. That sort of xylophoning across the top of the spinous processes generally feels fairly noxious. And so on. That specific work that I was doing along the laminar groove, I'm going to take that lateral. So we've got the laminar groove, and then we've got the mound of the longissimus through there, the sort of the more obvious erector muscle. And I'm going to be just sort of on the lateral edge of that. So I've been medial of it, so more over the spinalis and down into the deeper muscles along the spine. This time I'm going to take the contact out to the other side. I'm going to do it on the other side of Marin's body just to kind of create a little bit of symmetrical sensation for her. So I'll show this with my fingers to begin with. So here's the spinous process. Then I can palpate, feel for the mound here. So, and here's my contact. I'll start out with my fingers, and I'll do a little bit of this with my fingers. So I'll show it in a couple of spots. I won't treat the whole distance of this. In my practice, I would treat based on where I feel the restriction. So there'd be some very sort of deliberate element in my practice of wanting to isolate and make the work as economic as possible. So here, this is how it looks with the fingers. And here's how it would look with the elbow. So I'll do a little bit with the elbow in this position, and then I'm just going to come around to the other side of the table and change the elbow angle. Not so much because that's how I do it, but I'm thinking we might get a better shot of the contact of my elbow. So I'll see how that looks. I'll just develop this for a little bit longer. I'm just going to bring the elbow in from this side so you can see where it is that I'm landing there. We like to develop the contact with the periosteum of bone. I've talked about that at other times, and the ribs are no exception. As long as we don't gouge, rip, or thump on the ribs, we can land and work with quite a deliberate sense of engaging the periosteum, and it feels very nice. And it certainly does invite this sort of back motion in the breathing. There's the back of my ribs because you've got your elbow in there, and of course I can notice where they are and I can breathe towards them. And all those joints where the ribs join the vertebra start to move more as a result. Okay, so that's how that looks. And as we go down, we're starting to affect not just the longissimus and its related fascia, but we're also obviously picking up other muscles as well. Serratus posterior inferior would be one of them. So we're moving progressively, midline, lateral. Now I'm coming out even further. Once again, I'll show with my fingers. So I'll palpate the posterior angle of the ribs. So the ribs are turning as they come away from the spine, turning back. I'll find that posterior angle. I'll just show how you can work along the posterior angle there. And so I've taken, now I can't get quite that work done up around the scapula, so I'm showing it down here more at the bottom of the rib cage. And there I'm starting to transition a bit into the actual waistline, so I'm coming across the floating ribs, and you can see how this tissue here is generally starting to thicken quite a bit. And that's because we've now got the 3 layers of thoracolumbar fascia, and really this quite very thick pad of fascia that's at the base of the spine. And again, that could be done with an elbow, and that would be very useful. But here, just so you can actually see where it is that my hand's going, or where the contact's going, I'll just do it with my fingers. And another tool for this area can be the knuckles. And knuckles are like elbows. They don't have to be savage tools. They can be very useful, partly because the therapist can maintain a very nice long contact through the knuckles. So there's no strain really like there can be for some people with the fingers, and so that can leave that in contact with your client for quite a long time. Can go lower than that, and now we're into the area of the lumbar spine, working again close to the spine with my fingers so you can see what I'm doing. And on this pass or a subsequent pass, or even in 3 passes, I'd want to start to feel that I'm settling through into the underlying layers, so that by the time I get around the PSIS, which is what I'm contacting now, so that I've got my finger on the PSIS, by the time I get there, I feel that I am down to the level of the multifidus. So it might mean that I need to open out the superficial myofascia, and this is a really wonderful place to kind of let your fingers do some exploring, or let your fingers do the walking, I think is the ad that I was brought up on anyway, where we'll discover, there's localized areas of fibrosity in here and restriction. So here I'm finding one just slightly medial of the PSIS, so I'm taking my fingers and just exploring that, opening it out. And if we're working slowly enough here, one of the things that you're going to be doing is not just affecting the myofascia, which is a big part of what we're up to, of course, but as you slow the work down and leave that contact there, you're also going to start to affect the ligaments. And this can also be extremely useful and sort of tensions that have developed in the ligaments associated with vertebral rotation, sacral trauma. Yep, so this is the spine here, right finger, thumb, sacrum, base of sacrum. So there's that convergent zone of ligaments and fascia and tendons. And this is one of the really fertile areas to work in the body, just this whole base of the spine, sacral complex. And that doesn't have to be confined to the low back. The multifidus have, as you know, an attachment at the sacrum, and we have the continuation of that pad of fascia across the sacrum. So I could, using my fingers or my elbow, I could continue to employ that technology, land, sink, hook and drag. It's just that this time the landing and the sinking and the hooking and the dragging is happening fairly locally. Just like in the thoracic spine, I can take this wider, I can move across, so it can start in the midline. In the lamina, I can come wider, of course. Once again, I'll show that with my fingers, although that can feel very nice with the elbow. And as we start working in this more lateral portion of the posterior back, down here we're getting to that convergence zone of those three layers of thoracolumbar fascia. So we've got three posterior, laminar, and then a mid layer between the erectors and the quadratus. And then the one that lies between the quadratus and the psoas. So you can see here how I'm sort of turning back just slightly in towards my client's midline, even as I'm working inferiorly, and that's starting then to deepen that effect that will go into those different layers of fascia there. So I'm probably still just slightly medial of it, but you can see from the way I'm entering into this tissue that I'm starting to affect it. Here's the crest, and we like the contact at the periosteum. So I'm not stopping there, but bringing that contact onto the periosteum. And there's my even more lateral contact. I do use thumbs in my work. I know I don't put them down, but I definitely encourage people to diminish the amount of thumb work they do. But I think you can get some very nice specificity with the thumbs in this region, and that's how that might look. Just exploring, the tissue here in general, I can feel the TPs of the lumbar vertebra, and that tells you that I'm working at a fairly deep level, but I'm working slowly. And so not causing my model distress with that. So I can find that line coming off the inferior part of the rib cage. Yeah, and that's more that edge of that sort of seam or that rafe where the various layers of fascia meet. Like so. Okay, very good. So these are all in daily use in my practice. The seated work, the prone work. I want to show some variations on the seated work that then take the mobility, the softening, the release that we build in these different ways and bring it into something that's more at the level of kind of rehabilitation or some kind of motor learning where we can use some coordination of client movement with pressure to activate or facilitate the better recruitment or utilization of those more stabilizing muscles in the low back. So we know that the really excellent research done at the University of Queensland shows very clearly that one of the problems with recurrent back pain is that the smaller muscles, in particular the multifidus, become inactive, and those small multifidi act as the local stabilizers of the facet joints as they go through their motions, side bending and rotation. And the multifidus need to be able to guide and secure those motions. And when the multifidus, when there's back pain, the evidence from that wonderful work at the University of Queensland really does show that the multifidus starts to lose its cross-sectional diameter quite quickly, and probably then fairly quickly starts to go off the map in the sensory cortex. And then as it goes off the map in the sensory cortex, it would also go off the map in the motor cortex. So we have this kind of diminishing, spiraling down of function, and then the back becomes more vulnerable to re-injury. So some of the things that we'll be doing next, they're fun, they make the body feel really sort of turned on or perked up in a way, facilitated, but also seem to recruit or get these smaller muscles to engage a little bit more. So let's have a look at that next. Alright, so back to seated position, and this time you can see obviously I'm in quite a different relationship to my model, and the reason for that is because I want to bring some contact to bear right down here around the area of the PSISs. So there's the right one, there's the left one, and I'll start right on top of them. And that's the pads of my thumbs resting right onto the PSISs. And then I'm just going to put my fingers across onto the crests on either side, and I'm just going to give some fairly firm forward pressure, so anterior pressure. And then one of the important elements of this is the setup, and it's the same setup really as for the other seated back work, and by that I mean you'll want your client to be sitting in such a way that they're supporting through their feet, but not overcooking or overdoing the work in the front of their hips. So the hip flexors might be turned on slightly, so there could be a bit of activity there, but we don't want a sort of full-on heavy-duty contraction happening in front of the hip. Now what we're going to do here is I'm just going to initially have Maren push back from her right foot into my right thumb. So she's just going to push my thumb backwards from her foot. So she pushes away deliberately into the floor, and I feel the contact coming through. Yep, and I can confirm that, and the ways in which we confirm, obviously we could say, aha, there, I feel it, or something along those lines where we're kind of, yeah, it's happening. Or if we feel it's not happening too much, we just say, look, I'll leave the pressure there and just explore that a little bit more. Just see if you can really sort of push my thumb back. Very nice, and let go. And do the same on the other side now. Just bring the left side back a little bit. Good. Very nice. Good. and relax a little bit. Good, and now the right side. So I'll just get you to go through a series of kind of alternating motions. So you'll push back on the right side and push back on the left side. Yep, so just basically looking to introduce a little bit of rotation through here. And that's what we're getting happening here quite nicely. And you can go again. Yeah, just keep going with that, maybe 6 more times. Yes, very nice. Now I feel that there's very good connection through each side. Very, very nice. Yeah. And this is often enough. It just starts to activate some very nice local kind of micro motion in those smaller intrinsic muscles. But it's also happening good, and we'll rest there. It's also happening with this idea, well, not the idea actually, but really the actuality of closed kinetic chain. And so closed kinetic chain, she's got the distal part of her leg is fixed to the floor, and the motion's happening in the proximal part of her hip slightly, so her hips are in motion, micro motion, and then she's also getting this slight rotational motion going in the sacrum. And that's all being connected in through this closed kinetic chain. So this is activating more sort of proprioceptive feedbacks in the body, and this all seems very important when we're trying to awaken this response in the low back and that lumbosacral area. When do we use this? Well, we've done our very nice release work with them lying prone or some seated back work, but perhaps we've done very detailed work around their low back. They've come in with some difficulties in their low back, pain, dysfunction, instability. We've done some nice work. Things are starting to feel a lot better. So what we can do next is take that to some level of coordination, integration, and this is one way to do it. Stay with the same theme, but shift the focus. So I'm going to take my thumbs now off the PSIS, and I'll just put them in on either side of behind the transverse processes, really at the level of the crest. So coming across, putting my thumbs in there. So that's generally thought of as being the L4 level. And I'll just have a similar motion. It's just that this time we can do a little bit of bilateral flexion and extension, or backward bending and forward bending. So the first thing I'm going to do is just push Marin's vertebra forward, and she's going to allow that motion, but also sort of put the brakes on it slightly, so she doesn't just let her tummy pooch out and go all floppy, but she controls the motion. And one of the ways she'll do that is through keeping her transverses turned on. Yeah, so she can accommodate the curve developing in her back without the whole thing turning into just a feeling like becoming sort of unstable and being pushed in directions that might not feel comfortable. And then from your feet, just squeeze my thumbs back a little bit. Yeah, and come through a little bit more, and just exploring, finding that bilaterally. Good, good, good. Yes, and there's nice breath following on the pressure. Now we'll go the other way. I'll push you forward. Very nice. Yeah, and a little, yeah, that's good. So she's got this ability to yield and keep the brakes on, and that's exactly what we're looking for, this kind of controlled, graded motion, fairly close to the neutral position for the vertebra. And come back again, just feed this back, feeding this back. Good, and I can give, again, the same kinds of feedback. Yeah, I can, yeah, and this time I'm feeling it very clearly, and so I can just say that. Got it, maybe one side slightly more active than the other, and part of that might be because I'm sitting across asymmetrically, so you can get a good view of what we're doing there. So I feel like I'm probably giving a bit more to the right. And we'll go back the other way. Good, and then the other way. Good, and then the other way. Good. Yeah, and so we can start to go through it fairly quickly. One of the things that can happen is if we get too thoughtful about it, can start to become actually more effortful rather than less. Yeah, good, 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 and then we'll just narrow the range slightly, just start to make it a little bit more micro. Good, 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 very nice. Yep. And that's very often what your clients will feel. It's like, yes, the curve is back. And of course, when we see that the lumbar curve non-existent, the kyphosis coming all the way down into the lumbars, that's not a desirable situation. And so part of what you can affect with that is getting these smaller underlying muscles to start to activate and provide the kind of extension that's not so dependent on these big back muscles, but more these local muscles in action. We can do a similar thing with the thoracic spine, and this time we can close the kinetic chain via the arms on the wall. Maren has got her arms up on the wall, and she's no doubt, because she's done this before, is exploring the ways in which the contact can go through the whole hand. So very often there's a tendency for people to take the weight all over through this outer side, so it's the little finger and maybe the next one, but not much kind of grounding through the base of the thumb here. So we want to bring that to their attention if they're not getting it. And then just sort of curiosity too about, what's the texture of the wall? Just so that there's more sort of sensory curiosity, better sense of connection if the senses are curious about what it is they're contacting. And that's our setup. Here we're seeing nice organization of the scapula. So the scapula are still kind of living or residing around here in the back of the body, but they're not pinched in towards the vertebra. So there's still a nice sense of width, and the scapula aren't zooming around to the front and showing us a big winged scapula. So we've got this balance then between the width of the back and the front. So rather than just see, subscapularis, pec minor, rhomboids, we'd also like to really see serratus anterior as being really active in organizing this motion. I'm going to show this from the side, but you do it standing right behind them so that your pressure is symmetrical. I'm going to bring, again, a contact through both my thumbs, and I'll be pushing anterior, and to begin with I'll just ask my model to let that happen. So there's some sense that this vertebra can travel forward. Yes, and this is lovely because what Maren's doing is localizing that motion. So we're not seeing her sort of try to hinge all the way down in her lower back to get it. She's just letting the weight of my fingers carry that forward. And now you can push that back. Yeah, and that happens through the arms. Yeah, and this comes back. And so the arms and the shoulders stay wide. Even that seemed to help a little bit. Yeah, arms stay wide. Beautiful. So now I'm feeling that there's really a high amount of localized motion here. Very nice, yeah. Very nice. And so we'd go the other way again, so I'd just help this subside to the front, but she puts the brakes on it slightly. Once again, not just letting the whole thing sort of slump. We're wanting to keep the stability and coming back again. Very nice, yeah. So she can feel the elements, the things she's working with. So she's kind of constantly reconnecting to that sense of the shoulders as going wide rather than letting them just kind of round her scapula to the front. Yeah, reaching into the wall. And then we'll go the other way. And just like before, in the end we'd end up oscillating. We'd have bigger motions at the beginning and then coming back again. And then we'll oscillate to smaller motions. So we'd kind of have forward and back and forward but not quite so far, and back not quite so far. Good. And there we're and in doing that we're really starting to have that's good. We're really starting to have to utilize the intrinsic muscles. We just can't do those motions with muscles like trapezius or rhomboids or the big erector muscles. Very good. Okay, and rest. Okay, so I've got couple of red marks there, and that should help you understand where I've been. Somewhere around T3, T4 is often a pretty good zone, and that relates again to building that cervical curve. I talked about that in the cervical video, that one of the places that the cervical curve quite often doesn't happen from is this area around T3, T4. So this is also very nice for helping that transition zone where we go from kyphosis back into the cervical lordosis. And it can feel fantastic if you've got a really stuck vertebra. It's been sitting sort of forward bent or backward bent for a long time. Seems most commonly forward bent, but yeah, we also see the hyperextended segments in there. And you start to just play with this, getting this motion in there. It just can take a tremendous amount of pressure off locally, but curiously it will also feel like the shoulders sit better afterwards. Like the whole shoulder girdle will be responsive to getting this area working properly. By the way, if you hadn't already sort of ascertained that, these could be repeated in different places. Probably wouldn't work our way through the whole spine. It's a fair amount of work for the client to try to do all the spine, every vertebra in this way. A lot of isolation, fair degree of concentration, but perhaps if they're very sophisticated and have a lot of stamina, then you could certainly explore it. But it's more important really to get 2 or 3 key points to work well, and the rest of the spine will help itself along in a way and fit in with that. Good, let's look at a way to work with the back in the pediatric client. And here's a nice position that's not too challenging. It's a little bit more dynamic than just lying prone on the table. And you can see I've got my young model here positioned in this sort of primary C curve attitude, and I could just ask him to drop his head a little bit, and I can make then a contact here, and I can start to work down the back in this position. And of course with the small client you can cover a lot of territory with your fists, and you can become quite specific with what it is you get accomplished here simply by moving, say, from being focused through the first MP joint or adding the second and even the third. So it can be broad or we can be fairly specific, and this could be obviously taken all the way down through the back. And if the child's capable of this, I can just ask them just to pull yourself forward a little bit with your arms. So pull yourself in towards your knees and kind of curl over your knees a little bit more. And so I can start to change the angle here a little bit. And this is good. Position to affect the mobility also in the back of the ribs. As well as ease and soften and lengthen the erector muscles. There's, I think, a misperception that by working with the back in this way that there will somehow be a loss of the extensor tone, and that the body, that sort of primary support of those anti-gravity postural tonic erector muscles will somehow be diminished, and the child will perhaps go further into an unwanted kyphosis. But the evidence is quite strong across 20 years of my practice that working in this way actually assists with what I would really have to describe as normalizing the tone, and without doubt the outcome will be a better tone that's more useful in terms of developing trunk stability. And I highly encourage those of you who work with a high-tone child to consider this work, even though there might be a sense of it as being, I suppose, counterintuitive, that after 5, 6, 7 minutes of work done in the back this way, the overall coordination of the trunk position is enhanced and not diminished. Once again, it's fair to say that this work doesn't have to be confined to the pediatric population. It's a lovely position for anybody to receive work in. Really helps open the back out in a slightly more dynamic way than just lying prone, and at the same time isn't too demanding as some of the more complicated seated positions are that we looked at earlier in the DVD. Okay, thank you.